Hello, my name's Dylan Williams, and I'm a psychiatric mental health NP student. So I wanted to have a look at mental health disparities and decided to focus in on ADHD and behavior disruptive disorders, looking how they can lead to different outcomes among different ethnic groups. I'll start by going over ADHD and behavioral disorders as they're related but distinct disorders. There are now numerous papers out there that will show that white and BIPOC children have statistically significant differences in provider diagnoses of these disorders. In addition, BIPOC patients are less likely to receive psychiatric care, and this all leads to disparities in the treatment of some of these patients. Fortunately, there are some models that are helping to identify and alleviate these problems, and I will end the presentation by looking at a couple of those. Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common mental disorders affecting children. Symptoms include inattention, hyperactivity, and impulsivity. Many patients end up having a difficult time focusing on a single task. And while the cause isn't completely understood, there have been studies that show genetic link with a deficiency in the neurotransmitter dopamine and an overall reduction of the gray matter in the cerebrum. Treatments include therapy and a wide array of effective medications. And recently, the World Health Organization created a 25-question self-reporting tool called the Adult ADHD Self-Reporting Scale, the ASRS, which has over 80% sensitivity and a quite low false positive rate. Disruptive behavior disorders are a group of childhood behavior disorders, including conduct disorder and oppositional defiant disorder. There's no known cause for these, although a combination of genetic, psychological, and environmental factors are considered as a possible cause. And there are a couple of different diagnostic tools, but there's no standardized tool for this disorder, unlike with ADHD. So moving on to the disparities, a study by Toumani et al. Looked at 5th, 7th, and 10th grade students and found that in all age groups, in both sexes, white children were statistically more likely to have been diagnosed with ADHD by a medical professional. Consequently, these children were much more likely to be prescribed with ADHD medication. However, although they were diagnosed more often, when a parent-reported diagnostic system scale was provided, Black children were more likely to display the symptoms of characteristic of ADHD. Echoing this, a study by Beglivio et al. Looked at a sample of Black, Hispanic, and white serious juvenile offenders and found that white children were 40% more likely to be diagnosed with ADHD than their Black peers. And for conduct disorder, they found that Black males were 40% and Black females 54% more likely to be diagnosed with conduct disorder. It also found that Black males were 32% less likely to be receiving psychiatric care of any kind. A paper by Larson offers up school-based health centers as a way of overcoming some common barriers to mental health care. By having it at school, there's no need for family insurance or transportation to a medical center. By having the trained professionals in school, we can identify traumas early, and there's less stigma since you don't have to have your parent bringing you to the ER. Utilization of the aforementioned ASRS can help to overcome implicit biases within healthcare professionals so that previously undiagnosed BIPOC with ADHD can get the treatment and medications that they need. And understanding that childhood trauma is a strong predicator of many mental health disorders, including ADHD, it's important to recognize that BIPOC students are impacted by racial stress and trauma that their white peers don't have to experience. So the Salim offered up the DMyth-RT tool to help identify and conceptualize racial trauma. That's my presentation. Here's a list of my references. Thank you.